Welcome to Breathe, Sleep, Heal, Live, a radio show devoted to helping improve your quality of life with Dr. Stephen Olmos and the team from TMJ and Sleep Therapy Center of San Diego. An educational program where you will learn about pain, sleep, health, nutrition, and more.
Good morning. This is Dr. Stephen Olmos, and welcome to our program. Today's topic is going to be stress, myths versus truths. It's really an interesting concept that we have nowadays, that pretty much everything that we have is the result of stress. I mean, everything I see. Well, certainly stress aggravates existing problems, but is rarely the sole cause of an issue. And I think that that's where the confusion is. We have a general level of unhealth that then stress can magnify on people who have chronic pain issues or disturbed sleep. Certainly, the more fatigued you are, the more stress is going to be a factor for you. And in the people who have chronic pain situations like headaches and this sort of thing, and migraine, then certainly these people are already inflamed. A migraine means that if they look at an MRI of your brain, it's negative. That means you don't have any organic problems. You don't have a tumor. You don't have bleeding. There's nothing that needs surgery to correct. What you have is inflammation in the blood vessels that presses against your brain and makes your head hurt. So that inflammation very often is coming from the rest of your body, and specifically from digestive issues as well as breathing problems. So they all kind of relate. And it's basically the nerves of your face, the trigeminal nerve, that then becomes inflamed, and that's the nerves that innervate your brain that the blood vessels push on to make it hurt. So it's kind of a combination of these mechanical and inflammatory problems. And so people who have migraines, they are people who are chronic headaches. They have a high relationship to nasal obstruction and respiratory problems, asthma, sinusitis, these kinds of things. And mouth breathing produces systemic or your whole body inflammation. Remember, the nose is for filtering, moistening, and warming air to bring into your body, and mix with nitric oxide gas in your cheeks, and this allows you to heal and prevent yourself from respiratory infection. However, when you mouth breathe, then you bypass all of that and cause systemic or inflammation throughout your body. So mouth breathing can contribute to these problems, and certainly if you're mouth breathing and your mouth's open most day and night, then you're going to have face and jaw problems, and this is often what we see in our practice are people who actually have breathing problems. So that inflammation combined with the inflammation from their digestive tract causes them to have a low threshold. Now, people are born with a certain sensitivity to inflammation. So a person who has migraines is on what we call a bell-shaped curve. So you could be way down at the end where it just takes very little irritation to produce a raging headache, or you could be at the other end of the spectrum and have a person who really takes a lot of inflammation from a lot of different irritants to produce a headache. And so migraineurs, if you're one of these people that are quite sensitive, and I'm one of those people, then previously it didn't take very much for me to get a headache at all. Okay, perhaps if you're already systemically inflamed, then it doesn't take you much to push you over the edge. Perhaps you have a little stress, and that might be the trigger. Perhaps you aren't hydrated. You're not drinking water. That might be enough to trigger you. Perhaps you're not getting restful sleep. That could be a trigger. Or perhaps you consume something that's inflammatory. The kind of irritants and the nitrates and the sulfites that are in processed meats and wines and things like that, or cheese, can cause inflammation, caffeine. These are all things that can be triggers. So any one of them can push you over the edge. I'm reminded of my first anniversary with my wife. I took her to Mr. A's. We were going to have a beautiful dinner. We sat down, and while we were having the Caesar salad put together, I was going to have a sip of wine with her, red wine, and within, I'd say, a minute or 2 minutes, I had a raging migraine, and we had to leave, and that was our dinner. Interesting enough, we just celebrated her birthday just last week. Same restaurant, same table, many years later, and we enjoyed a whole glass, two glasses, I think, of red wine. The same wine that I couldn't drink previously and had absolutely no problem. Well, I'm the same person. However, my general inflammation is dramatically lower because the things that were producing it were corrected. And that's what I'm trying to share in this program. People are always given advice. Sometimes they give it from perspective of helping other people. But I think one of the benefits that I've had in my life is that I've been a sick person, and I can empathize, and I know exactly how that feels. I know what a migraine is. I know about curling up in a dark room and praying you pass out, so that because the pain's so intense, it doesn't matter how many type of drugs you take, it doesn't take the edge off. So I know that sensation. I've not had to have that situation in many years because I've corrected the problems. Nasal surgery, change the diet, treat my apnea. These are all things that prevent me from being in those situations. And that's where we want to come back to stress. Okay? So stress, in dentistry, I hear this quite often, that people grind their teeth because of stress. And, over the years, you look at the literature, and you see that over and over again, they will take people and they'll put electrodes on their face, and they'll do surveys, and they'll ask the people, "Do you have stress?" And the people will say yes. So that's called self-reported stress. So they'll look at this, and then they'll try to correlate these people that say they have stress, and are they grinding their teeth more? And they don't ever see a correlation. And the same thing about anxiety. Oh, well, anxiety is comorbid with these problems and stress. Well, no. Or TMJ problems. In other words, problems of the jaw joint and the face pain. Are these correlated? Well, no. Studies keep showing over and over that they're not related, that they do not have a comorbidity, what we call comorbidity or relationship. And so we're not able to duplicate this, although this is the most common wives' tale I hear, is that now certainly, for a short period of time, that certainly may be the case. If you're very worried about something, yes, that will disturb your sleep. Because you may have an episode or two in that situation, but in these situations of chronic pain and chronic problems, then that becomes less of an issue. The issue about these kinds of things is that there's a functional problem. And that functional problem is creating that situation. Let's talk about grinding your teeth, okay? Well, let's talk about it nighttime grinding your teeth, all right? So that's called bruxism. And the actual definition, because it is a medical term, a medical condition, if you will, sleep bruxism is a medical condition. It's in the same category as restless leg or periodic limb movement. It's a movement disorder. It is not normal. So when you have excessive either grinding, clenching, or thrusting of your jaw while you're asleep, then that is a medical disorder. And what creates that situation is arousals or awakenings. So the mechanism is that something has to take you from restful sleep, wake you up, and then stimulate your brain to then cause these muscles to contract and move. So it's actually the change from restful, deeper sleep to lighter sleep that then creates this movement disorder. And the more frequently that happens, then the greater that condition. So something has to be taking you from restful sleep. And so the thought process is this stress. Well, no. What we're finding is that that's often more related to a breathing problem. That could be a breathing problem where you have to mouth breathe because you can't nose breathe. That shows a correlation between grinding your teeth. And we see this in children and adults across the board. And so the face pain and problems and things that people do. Now, many times dentists will make night guards for people who are grinding their teeth. Well, the problem is that if you have a breathing disorder like obstructive sleep apnea, where your throat closes up, and you have a night guard, then it actually makes the breathing problem 50% worse 40% of the time. So of all the people who have that, you don't know which one of those is that 40% that's going to be worsened dramatically by wearing that. So that's why we have to have good diagnosis. And then guess what happens? I think you've all been in situations where you've been fatigued and you're ready, let's say the day before you're ready to go on vacation, and you have the same conversation with somebody, and boy, you just, it just raises the hair on your arms and you're just really, really anxious and stressed out about that. Then you go on vacation and you come back and you have exactly the same encounter, exactly the same person, and now it kind of rolls off your back. In other words, your level of fatigue will determine your stress levels, and the less restful sleep you have, the more you will react to stress. So certainly there are situations that are extremely tough, business, personal relationships, everything, absolutely. And certainly that would manifest itself in daytime clenching and grinding. So there's a difference between daytime and nighttime grinding and clenching your teeth, because you see, your brain works differently. During the day, when you bite down, the nerve endings around your teeth have sensors. They're called proprioception. And that goes to your brain, your cerebrum. And so you know how hard you're biting. And if you do it too much, you'll stop yourself. That's biofeedback. And that's why we have all these different biofeedback techniques for people that are clenching because of stress and this sort of thing. However, when you're unconscious, that sensation does not go to your brain. It goes to your brain stem, your cerebellum, and so you're not really conscious of how hard you're biting. That's why we bite 5 times harder when we're asleep, and that's why people end up with facial pain and jaw problems when they awake. And this is the correlation that people are trying to say, well, this is a stress, but that's what has not been able to been duplicated. Even with sensors on their muscles all night long, we haven't been able to duplicate the stress factor in those chronic situations. Functional breathing, yes. Stress, not so much. So the factor there is that if you're not getting restful sleep and you're grinding your teeth because you're being disturbed from proper sleep, then you're going to wake tired, and now whatever stress you have is going to be magnified. And then we can see a relationship in the daytime, because if your face and jaw already hurts when you wake up, and now you have some stress during the day, you can see how your tolerance for that will be so much lower. And that's why you're going to see symptoms so quickly. So I think that we need to take another look at stress and how it's a factor, and see how it hurts the rest of the body in our next segment. I'm Dr. Stephen Olmos. Our program, Breathe, Sleep, Heal, Live. For those of you that are just coming on, or others who may want to hear previous recordings, we can direct you to our website, www.tmjsleepsd.com. And if you'd like questions answered, you can call our office, and our staff will be very happy to answer your questions at 619-466-2774. So we wanted to come back to this thought process about stress. And I just wanted to make this point, is that without a doubt, chronic stress is a strain to the body. But if your body is already weakened from other structural and functional things, then it's going to magnify the result. And that's really the point, is that certainly the absence of stress would certainly change us dramatically. But understand that stress is necessary and normal. I think sometimes people think that stress is only negative, but it is necessary for our survival. Give you, for instance, I think nowadays sometimes we think that only modern people have stress, that there wasn't stress in primitive times. Well, think about it. Think how much stress there was when you're walking around hoping food will come by today, or hoping that you're not the food for some other animal. Stress is a basic function of our lives and is important to our existence. So too much of anything is bad, and that's really the whole point. Is it's all about balance. It's all about getting everything in the right perspective. Otherwise, you tip the boat, and so therefore, things that you can do to reduce stress, believe it or not, is breathe through your nose. If you were to just and some of you may have difficulty in this because you have obstructions in your noses. That's why sometimes you have to dilate your nasal valves to open them, and you can always lift up on your cheekbones. The people that use Breathe Right strips to be able to breathe. So sometimes they need that to open that up, and sometimes they need spray. One of the over-the-counter sprays that I think works very good is Clear, XLEAR, which is a hyperosmotic saline and xylitol spray. And it opens up the nasal passages so that you can breathe through your nose. Because if you want to calm yourself down, just breathe through your nose. Close your mouth and breathe through your nose. You take 3 or 4 inhale and exhales through your nose, I promise you you will feel very calmed down. It will bring you from a heightened state of sympathetic panic to one of parasympathetic and slowed down. So that's why a lot of these exercises and yogas and Buteyko and other types of techniques are all nasally oriented, because it's not just about breathing properly for aeration. It's about calming your nervous system. And so these are some simple things that anyone can do during stressful times. And I promise you it will work very effectively for you. So there's been some questions that have come as we've been going through the broadcast here, and I'm going to ask Colette to propose these questions so that I can answer them.
Okay, Dr. Olmos. Donna has sent in the question. Let's see. She's saying, I think I'm understanding that you're saying if I'm taking Valium for stress and anxiety, it may not even be helping the TMJ problem I've been told I have. So I'm a little concerned about what I'm taking and what I should do.
Well, I don't know all of the reasons why you're having a problem, Donna, but Valium does a number of things. Valium is actually in a category where it's an anti-anxiety drug. However, it's a very potent muscle relaxant, and it's also a pretty good analgesic or pain pill, if you will. So it does a lot of different things, and so then the symptoms of the anxiety are going to be increased muscle tone. And so that's where you're using the muscles of your face to clench and gives you facial pain. However, people, so anxiety and depression, we look at these as being very often comorbid with breathing problems. And literature shows that people who are on depressive medicines and anti-anxiety meds who have a breathing disorder, when the breathing disorder is treated, then they've been able to get off their antidepressive medicines. So I don't know whether or not you are in that category, but that's something that should be investigated because the thing I'm always amazed at, the most vital function of life is breathing, and proper functional breathing means nasal breathing. And of all the things that we get examined when we go to healthcare practitioners, The one that is least or never evaluated is breathing. So that's why it's often omitted and not seen and not part of the plan. And of course, very often we're managing symptoms and try to find origins.
Thank you, Dr. Olmos. Terry B. has a question, and this is from a previous segment. He says, the whole inflammation thing is confusing to me because I don't have any swelling anywhere that I can see or feel, and I'm a very fit person. So I have all these problems, but I don't understand how it could be inflammation.
Yeah, the inflammation isn't something that you visualize. It's internal. It's in your blood vessels. So it'd be difficult for you to see that. It isn't the inflammation. Well, I mean, you could have inflammation in joints and things like that. Overload to a structure causes inflammation in a local place like a knee or a hip, and you're probably familiar with that kind of sensation. But the kinds of inflammation we're speaking about is inflammation throughout the whole body, and that's carried by the vascular system. So this usually produces situations where the person might develop a whole body achiness, like fibromyalgia and this sort of thing, and cardiovascular disease. Now, here's the one problem between men and women, Terry. Men don't feel pain like women do. Women have more peripheral pain receptors. Women have estrogen. Estrogen causes more fluid edema. So in the same injury, women swell greater than men. Women have more complete transmission of pain because of estrogen. So women feel pain more than men do, and that's why usually they seek care greater than men. Unfortunately, men, because of testosterone, which mitigates or kind of covers up those symptoms, we don't know what's happening to us until it's too late. And that's why we don't last as long as women do. So we don't have the alarms. We just go until we stop. So you can have lots of things that aren't working well, and you don't even know that until the end point. But you can know that things aren't proper. And so if you have disturbances of sleep, like you can't get to sleep, or you have to get up in the middle of the night to go to the bathroom, or you have interrupted sleep, or you wake fatigued, well, these are all the precursors for problems that you would have in the daytime with the inflammation we're talking about. Also, if you have digestive issues and this sort of thing, you might not call that inflammation, but that's what that is. And that's being pumped throughout your whole body. So you just may not have the sensors. We get gentlemen in all the time who have breathing disorders, and we look at the x-rays of their jaw, and half their jaws are melted away, and we ask the people, doesn't that hurt? And men, they would say, no, I don't feel anything at all. We're just not that aware of these things. Whereas in women, if you're in that situation, it's highly inflamed, and they're very much aware of that situation. So basically, that's the difference between men and women.
Lucky women. So Jen is asking, Dr. Olmos, what exactly is glycemic index, and is it important only for me? I'm a diabetic, or is it something I should be looking at for my whole family? I've never been sure.
Well, that's a really good question. I should have explained that. Glycemic index is how much a food substance spikes your insulin level, and it's on a rate of 0 to 100, and it's based on glucose. How much does glucose introduction into your system would spike your insulin levels to the 100 mark, and then everything is based off of that. So, being a diabetic, you certainly you would want to keep a close eye on the things you consume, because every time you spike that, now depending on what kind of diabetic you are, if you're a type 1, then you need to you have different concerns because your body isn't producing insulin, and you have to inject it. But if you're a type 2, as most people are, they produced their problem. They weren't born with that. And what happened there is were taking so much sugar for so long and producing so much insulin that their body stopped responding to it. So, so the solution to that is more insulin because of the high sugar intake. So So in preventing diabetes, it's extremely important to look at glycemic index and what you eat, and it's equally and greater importance for the people who already have it.
Thank you. Here's another diabetic. So MB says, I have both the diabetes and high blood pressure you mentioned, and I'm also a snorer, but nobody's ever tested me for sleep apnea, and now I'm wondering if I should ask about that.
I certainly would if I had those conditions, because those are highly, highly correlated to a breathing disorder, specifically obstructive sleep apnea. So, yes, I would definitely bring it to your physician's attention and request a sleep study. Because in addition to those symptoms that you have there, so there's always 3 questions I ask patients. Can you get to sleep? Can you stay asleep? And do you wake rested? Because if you have to sedate yourself to go to sleep, one of the very big reasons for that can be chronic pain, can keep you awake because you're in discomfort. 2, your brain protects you against going to sleep if it knows you're going to suffocate when you go to sleep. So that's why often people are having to give drugs to sedate them. And then if they're woken from sleep because of suffocation and the pressure on their heart causes the brain to think that there's too much fluid, the body produces a diuretic hormone that causes you to have to go to the bathroom. And you may be able to, a person who gets to sleep and stays asleep, but then you wake fatigued. So these are all symptoms, and you should put that in combination with the other symptoms you said, and you should go see your doctor and explain that, because that has a very high correlation. Well, I want to say thank you for another great broadcast. Thank you, Colette, for helping us out here today, and we'll look forward to our future meetings.
Be sure to listen to Breathe, Sleep, Heal, Live every Saturday at 11 a.m., where you will hear from the experts at TMJ and Sleep Therapy Center of San Diego. Visit us at tmjsleepsd.com and learn more about treatments for chronic pain and sleep breathing disorders. Or if you have any questions you would like us to address on the next show, please email us at info@tmjtherapycenter.com.